Hello and welcome. I'm Nicole Springer, the Chief Equity Officer and Senior Director of Professional Development and Scholarship with Campus Compact. We are excited about our partnership with the Academy of Community Engagement Scholarship as co-creators of this series. ACES is an organization that recognizes exceptional leaders who live at the intersection of academics and communities to benefit society. Together, we bring to you this series on addressing wicked issues through community engaged scholarship. This year, we will focus on youth and gun violence, exploring the context, the root causes, and how higher education can respond. As many of you know, today's theme is community engaged research, and leading the charge is Campus Compact's Wicked Issues Fellow, Dr. Camille Williamson. So, without further delay, I will hand this over to Dr. Williamson. Thank you for being here.
Thank you so much, Nicole, and thank you all for being here. Wherever you are, I hope that you are warm and dry. Lots of different climate change induced weather patterns that we see going on. So please remember to stay safe. As Nicole mentioned, I'm Dr. Camille Williamson, and I'm happy to be here with two panelists, Terry L. Williams and Dr. Rabiatu Berry. If you have not had a chance to look at the recording of the first video, I've been told that it will be posted on the website for this Wicked Issue series. And that is the opening kickoff conversation to understanding more about wicked problems. There were two panelists that walked us through the understanding of the wicked problems, and in particular, the focal point of this year, youth and gun violence. As a reminder, wicked issues are very challenging to deal with. So, for example, um, climate change might be considered a wicked issue. They tend to be very large problems that are hard to kind of just completely wrap your arms around. It can be very challenging to define them, determine solutions. We learn that sometimes there are unintended consequences of some of the um, pieces of solutions that we put together. So, to say the least, wicked issues, wicked problems are hard to solve, big in nature, and impacts everyone, whether they realize it or not. So, to continue our conversation, today we're focusing on community engaged research as it pertains to looking at this wicked issue of youth and gun violence. I encourage you to continue to review the website, to review that recording, and to stay up to date with the remainder of the series for the year. At this time, I'd like to take a moment to introduce our panelists who will be joining us today. So, our first panelist is Dr. Rabiatu Berry, who is an assistant professor in the Family Science Department of University of Maryland College Park School of Public Health. As a community-based intervention and prevention specialist, Dr. Berry's work seeks to reduce negative mental health outcomes among Black boys and to develop family and community-based interventions that support their healthy development. Her core interests areas are African American youth identity development, gendered racial socialization of African American boys, Black masculinity, trauma, traumatic stress in Black boys, community violence, community-based gun violence, and intervention science. Dr. Rabiatu and I go way back from a previous institution where I was glad to get into some good trouble with her. Welcome, Dr. Berry. We're excited to have you.
Thank you.
Our second panelist for today is someone else I go way back with, Sergeant Terry L. Williams. Terry is a proud native of Chicago's greater Englewood and Woodlawn communities, where the majority of Terry's family still resides as invested residents. Terry completed his undergraduate degree in sociology with an emphasis in criminology at Northern Illinois University. And Terry also completed his emergency management and continuity graduate certificate at UIC at Chicago, where Terry also earned a master's in public health. In 2019, Terry was selected to serve as a student research fellow with the Chicago Gun Violence Research Collaborative. He was invited to return and serve as a mentor fellow for the 2020 fellow cohort, and in 2021 and in 2022, he served as a faculty fellow for the collaborative. He is also recently selected to serve on the steering committee of the collaborative. And as a panelist today, Sergeant Terry Williams is here to represent his own thoughts and opinions on the questions that I asked the panel, and they do not reflect the thoughts and opinions or policies of the Chicago Police Department. I'm sure Terry will also um, share how to receive any kind of insight that he's able to provide for us today. So, welcome, panelists. Welcome, all of our participants for today. I'm excited to get into this discussion. And why don't we start with um, Dr. Berry? How would you describe community engaged research and why it is important?
Hi, Dr. Williamson. Thank you for having me on, and hello to everyone who is here. Um, so community engaged research has like main definitions based on who's talking about it. Um, but for me, community engaged research is a partnership, a actual partnership between an institution and the community closest to whatever the phenomenon is. And so what that looks like is usually an institution. In this case, we're talking about higher ed. So let's say higher ed. It's our responsibility to go to the community and first join with the community with what's already happening there, and build the community connections and relationships to then work with people to co-create projects. A lot of times, usually, the institution will come with something already, and that's not necessarily always bad. I think we get a bad rap for this idea that like, oh, it's not really community engaged if this institution comes with a question already, but that is a way to start a relationship. But even if you come with your question already, I think that the design of the research project, it should be in collaboration and partnership with the community, even if you show up with a question already.
Mhm.
Right. Because I think in my work, I found that sometimes trying to go from like the 000 portion of like being thought partners, depending on who you find, they actually might find that burdensome. Like we have enough stuff, like we're doing the work here already, like, and you want us to help you come up with a project, like that's a lot. So like, this is what's going on, you're welcome to come up with, and then we can work together to design the thing, and we can give you input on the best way to do this thing and for us to do it together. And so I think from research design all the way through, they should be co-PIs as academic languages, and uh, like designing the study, collecting the data. If it's qualitative, they should be part of interviewing. They should be part of data analysis. They should be part of dissemination. I actually tried to get one of my community partners to come here today. He just happened to be busy. He wasn't able to come. But when we do public conversation, they should also always be present. Because a lot of the times they're the ones who are doing the legwork when the higher ed person is not there. They are the person who is the link between the university and the community, the one who the people trust and who really are taking a particular big risk on their name, their reputation in the community by vouching for you. So, and they should be co-authors on any publication that comes out. And then the thing should be theirs, right? And that my goal is always to air quote work myself out of a job, in the sense of once we create the thing, do the thing, that the thing becomes theirs, and I become a facilitator, supporter of the thing, because it's ultimately about the wicked problem and not about the kind of university needs. And so I think that's, for me, community engaged research is about really engagement and building relationship and staying in constant relationship. And that also includes doing service to the community when you're not getting anything from it. And I think we forget about the community service part when you're a university employee and you're on the university side, that you're gonna have to do more than just like collaborate on that project. You're gonna have to show up in other ways when it doesn't necessarily benefit your project,
Mm.
and become part of the community. Even if you don't live there, you need to become part of the community. So
Gotcha. Thank you for sharing that. Terry, how would you describe community engaged research?
Well, thank you, Dr. Williamson, for the invitation, and thank you everyone else for being here to listen to the series, a phenomenal series at that. I think just to summarize some of the things that Dr. Berry had mentioned, community engaged research, community-based research, however you want to kind of frame that question or that term, is really an ethnographic approach. You know, you have to really meet people where they are. And one thing that we've discovered and just the research outside of the role that you see on the screen right now in uniform. I do a lot of other research in the community. A lot of the community, they are frustrated with institutions coming in and being extractive, versus putting in value into that research. So I absolutely agree with Dr. Berry on the co-PI concept or the co-partnership concept for them to own that research, own their own voices, own, what's put out and what's being taken out, what's been taken from them. So you want to kind of get away from, being that extractive lens or extractive institution. I would even take it a step further to, developing advocates of research and within the community. When it comes to community-based participatory research or
Mhm.
asset-based community development, and both of these concepts have been studied by academic institutions. So just really narrowing in on where are people, and not only geographically, but where they are, in their psychological beliefs of the institution and their psychological beliefs of what type of topic you're talking about, and then just capturing that and meeting them right there where they are, and then build from there.
Mm. Thank you so much. I really appreciate your complimentary answers. And Terry, just sticking with you, what drew you to want to learn more about youth and gun violence?
I'm sorry, repeat that?
What drew you to want to
Oh.
learn more about youth and gun violence?
So obviously, I've been a black male growing up in Chicago, the inner city of Chicago. It's no secret that um, gun violence have really plagued our community. Yeah, the Surgeon General, really recently just stated that it was gun violence is a public health issue. We all know, even the CDC mentioned that firearm homicides are the highest amongst Black and Brown communities, um, specifically between the ages of 15 and 35. And I don't need the CDC to say, to make that statement. I know friends, family, people that lived experience that have suffered, the families that have suffered. And I look at it on a professional level, just looking at not only the numbers, not looking at it from a epidemic, standpoint, but looking at it from a, firsthand experience, seeing these families impacted, and not only by the incident itself, but the trauma that comes along, the indirect trauma that comes along, the community trauma, however you want to look at it, on whatever level you want to look at it, it's impacting of us all to the point where we're starting to get desensitized as a society and as a community. Oh, that's not really, it's not really affecting me until it does,
Mm,
so I really wanted to explore a little bit more what the root causes were,
mm,
and looking at the social the determinants, and just learning more, and specifically starting with the youth because they have a big voice. They know what's going on, and obviously they're the ones that are affected by it the most, but they are so they're in it. They're committing some of these these incidents as well. So it's pretty interesting.
mhm. And Dr. Berry, can you share what drew you to studying more about youth and gun violence?
Yeah, so I moved to Chicago in 2005 as a graduate student to get, my doctorate in psychology. And so, for one of our first things is, in practicum, right? We have to do our clinical practica where we take clients, and I was always interested in childhood trauma, but I was thinking more from the child welfare frame. And I will say it was probably one of my first clients. She was in my office. She was a 16-year-old girl, and she was in therapy because She was basically sitting in the car with her boyfriend when somebody walked up to the car and shot him. And you know, I'm from Florida, I'm a little Southern girl and pretty sheltered. And nothing, there's not gun violence in Florida, but not, you know, parts where I lived. And so it was my first time having like up close, kind of like intimate knowledge of someone who was shot. And training in Chicago and working in Chicago with Chicago youth, the gun violence, the impact of it was inescapable. I did not, every sixth client that I was assigned was there either because they themselves had been shot, or a family member or a friend or a sibling or a classmate. And it just became an inescapable phenomenon that I engaged with doing clinical work in Chicago. And so it chose me because there was no way to avoid it clinically. And it was sad to lose, and I might me myself losing kids. And at one point I worked at you know, Chicagoans affectionately called the Audie Home, also known as CCJTDC. And the kids that I met there I worked there for 2 years on the unit. And to see the complexity of these kids who were there for attempted murders. I worked on the fourth floor, which was the kids who had violent crimes. And to see almost like the dichotomy, like when they were there, they were very much just little boys. They chasing each other, running, wrestling, right? But then to find out that he's there for attempted murder, it was just like such a jarring thing to experience, to see both sides of the barrel. So that's, you know, how I found myself here.
Gotcha.
This work.
And what research have you been involved with? And if you could share any findings that you think are pertinent to today's discussion.
Yeah. Most of my findings mostly my personal findings are clinical. My projects that I've started at Maryland are part of the intervention science work that I do. So the first one is a hospital-based family intervention for youth who've been injured by gunshot. And that was actually inspired by my clinical work in Chicago and finding that the captive audience that they had when the kids were on the inpatient unit after being shot wasn't being utilized, I felt like, in a really good way. And so the point of this intervention is to try to do some acute treatment on the medical floor before the family goes home, to prepare them for a return into the community, a return to school, to ideally mitigate some of the traumatic stress symptoms, and get Black families to engage in post like outpatient treatment, because the follow-up outpatient treatment is abysmal in Chicago. I don't know the stats as well here yet, because I've only been here for 2 years, but in Chicago they were abysmal, right? Like even for the actual wound itself, I want to say there was a return rate of about less than 30%. If the family felt like they could do the wound at home, they would just do the wound at home and they would not go back to the hospital. And the connection to outpatient services was even worse. But we also know from the therapy clinical literature that when it comes to Black people in psychotherapy, that if you can get them to see the usefulness of it in their life in the first 3 sessions, they persist beyond the 26 session plateau. So in the literature, there's pretty much like a 26 session plateau, that about 26 sessions, people kind of plateau, drop off. But Black people actually will go beyond that median point if you can get them in the first 3 sessions. But if you don't get them in the first 3 sessions, they don't come back. Like, you know, so the point is, if you can get them on the medical floor, that they'll be more likely to engage in therapeutic services when they leave the hospital, which is really when the symptoms of traumatic stress will show themselves, not, you know, on the hospital floor. And so some of the work that's been done in one of the centers at Maryland that I'm affiliated with, called Progress. So I don't want to get the acronym wrong, so I have to pull it up. It's called Prevent Gun Violence Research, Empowerment, Strategies, and Solutions. And so it's a coalition that's led by Woody Kessel and Joe Richardson, who do a lot of this work and have done this work. Dr. Richardson has a documentary, if anybody's interested, called Life After the Gunshot. It's really great. And it's a lot of work that we've done is about CVI work and the community violence intervention work. And some of really important research that has come out about that, particularly, is like the usefulness and the efficacy of these community violence interventions, formerly known as things like ceasefire, and doing having CBI workers who are on hospital floors, as well as those who go into the community to kind of like interrupt conflict. We find that the CBI interventions that utilize CBT are actually pretty effective, but also found that the most effective are the ones that meet this gold standard and are really, really intensive. So some of the, out of the criminology space, they talk about these places called hotspots, and that some of the policing strategies they used was to target hotspots because it's not everyone who's engaging in the violence, right? It's just like a small group of people, obviously impacting the community, but the actual perpetrators are like a small group of people. And that some areas they collaborate, the police and the CBI workers and agencies collaborated around targeting these hotspots, and found that to be effective, which is great. The problem is that for it to be effective and have to be like gold standard and really, really intensive requires a lot of resources. A lot of cities, I don't want to say they don't have the resources, they don't give the resources required to do these kinds of interventions at the level that it would need to be done to meet the level of efficacy that we've seen. But it is efficacious in different cities, even as it is now. Those who use CBT interventions, the CBI workers find it to be useful in their work with the youth in these communities that they meet, in hospitals and on the corner. So if there's places that people are interested in looking in, and how we can make CBI interventions better and more useful on the ground without necessarily having to be gold standard, because as much as we would love to say that agencies in our community, our government offices will fund such things, we know that it's not true, because as of Monday night, the presidential office for gun violence is no more, right? Because we have a change of administration. So that office of gun violence prevention that was president appointed is now gone, right? And a lot of federal funding was coming out of that office, was sparked by the creation of that office, and now that office is gone. And so pretty soon the funds are going to dry up too. So here we are.
Thank you so much for sharing that. Terry, same question to you. What kind of research have you conducted, and can you share not only some of the findings, but what you're doing with those findings?
Yeah, absolutely. So I want to, before I answer that, I just want to talk, just touch on Dr. Berry's point of CBI workers. Absolutely, again, agree with, the concept of a CBI worker, because they're so similar to community health workers. You're supporting people with health literacy. You support people with whatever, information that they need to get connected to the right resources. So, advocating for CBI workers, community health workers, which I think should be merged, it will be dramatically impactful for community-based research and, community advocacy, community literacy, health literacy, so on and so forth. But, just recently in just last year, 2025, there was an article published called an academic community partnership to address gun violence in the Roseland neighborhood of Chicago. And sorry about that. On duty. Try to cut this radio off. And in that article, that academic article, it really summarized some of the work we did back in 2021, 2022, as it relate to, studying youth-based violence in the Roseland community of Chicago. We actually led a project called Research Activism for Youth Voice, where we studied young Black males. It was actually collaboration with Kids Off the Block, which is a community-based organization. But Kids Off the Block, and they had 25 youth. They helped us, get them a survey out to, just learn more about their experience growing up in Chicago, looking at some of those themes, as it pertains to, qualitative responses, and then measure those responses in a qualitative manner. It was more participatory research that really looked at an asset-based approach to enable them to really identify what they felt was an asset around them.
Mm,
What resource could they go to kind of support them in addressing those social determinants. And it was pretty interesting to learn that some of those community stakeholders saw local people, local businesses, local organization as their primary asset, that's around them. They can go right down the street and to their local church, faith-based organization, or to their
mm,
local community-based organization, and get the resources that they need. The pandemic has showed us so much, so much. And I can go on and on to talk about what was magnified during that time. But specifically, people reallocating their roles and changing their roles like community-based workers, where they were passing out food. Food
mhm,
pantries started to pop up, to address the food disparities. Learning more about underlining conditions. Remember that underlining condition. What exactly is an underlining condition? So a lot was learned from there that, so advocates from there. So supporting that, projects like that, and getting that research published last year, and that was led by Dr. Sherbert, uh, Dan Sherbert, and his team, some other local community partners that supported that article. So I encourage everybody to look at the research that we did there, and of course helping on uh, any work that the Chicago Gun Violence Research Collaborative may have done or have coming up, and then on a professional level, supporting any other research in the
mhm.
community. I can go into some other spaces, but just for the sake of time, uh, I ended right there as far as some recent research.
Thank you for sharing that. Can you share a little bit more about your experience with the Chicago Gun Violence Research Collaborative?
Yeah, absolutely. I think that was a phenomenal experience. Like I said, you had mentioned in my intro. I started to get involved as a fellow
Mhm,
in my master's program, and then went back as a faculty, excuse me, as a mentor, and then went back as a faculty advisor to the other researchers, young student researchers that were coming in, and now supporting it on the steering committee level, just to again empower our youth, empower our organizations, academic organizations, and some of these researchers. Let's be honest here. A lot of people that's in academia, they really don't have the lived experience,
mhm,
that's needed to really do the community-based research. So having lived experience both personally and professionally, and giving that lens from a public health, public safety perspective, and as again, Black male growing up not only in Chicago, but the inner city of Chicago, offered me a different lens of looking at things, and looking at disparities, dissecting and, sometimes transcribing things and advocating for our youth and our communities and the assets and what exactly is an asset, what do they mean by, on phone them,
mhm,
transcribing, transcribing some of that language and just, really humanizing communities, because instead of looking at zip codes and
mhm,
statistics and data, these are families that's being impacted by these numbers. These are not just numbers; these are families. So that was a amazing experience, and continue to support not only that collaborative but other partnerships um, that come out of when it comes to supporting our youth.
Thank you for sharing that. And I'm particularly struck by your statement around having a lived experience to develop a lens in which to have a comprehensive view of a wicked problem. And
So
in that vein, my next question to you all, I can kick it back to you, Dr. Berry. what role and responsibility do you see for higher ed with this wicked problem? Just bearing in mind, like, the importance of that lived experience. Maybe in Terry, you also talked about maybe even a community health worker model being infused to address it, which is oftentimes with a multitude of partnerships, like university, it could be hospital, clinic, as well as community-based organizations. And it's not unusual for wicked problems to have a number of different players to come together to try to look at solutions. But specifically around higher ed, and I appreciate you raising that important factor of a lens coming from a lived experience. What responsibility does higher ed have in addressing this wicked problem?
I think we have the responsibility of making the connections and providing the resources, particularly to the people who do have the lived experience, who are doing the work to address the problem, right? Because they are the closest to the phenomenon, they do have the lived experience, but they also do get burnt out. So lots of scholarship around what CVI workers experience, and the toll it takes actually on them individually to be these, lack of a better word, firefighters who they're like never off the clock, right? Because
Mhm,
most people, don't get shot during business hours, right?
mhm,
Right? Like they're getting shot at 1, 2, 3 o'clock in the morning. They're getting out the bed, going to the hospital. And providing them with resources, also providing resources for community. And I think there's one big thing that higher ed actually can do, is we think that like when we think of college students, there's like a archetype of what we think a college student is. But what I've found is there are a lot of college students who are first gen, who come from these communities, who never get an opportunity, like they don't go home, and nobody in the community gets to see people who have their lived experiences, who leave that space and what that even looks like. And so for me, I feel like my also biggest contribution is bringing my students to the community, because they're in a learning space. They're more open, they're more flexible. And it provides opportunity for the students who have the lived experience to do the work, to be part of the solution for the community that they left and that's at home. It gives the community, particularly think about youth, opportunity to see people who are closer in age to them, who they can identify with, who have the same lived experience as them, do other things, who might have been shot before, who might have even engaged in that behavior before, who found a way to down another path. And it trains the next group of academicians to recognize that these people are human. Like he said, these are families, they are not zip codes, they are not projects, they are actual living, breathing people. And to be trained to think about research this way from the very beginning. Because a lot of people are
mhm,
retraining their minds, because now there's a trend towards community engaged research. A lot of people are trying to like make themselves being community engaged researchers. It's not a slight, it's not shade, it's the way people have been trained. It was a very traditional model. People are trying to like retrain their brain, which is much more challenging than if we were trained like that initially, right?
mhm,
To do that work in that way initially, to think about research in communities that way initially, and thinking of research as for me, a liberation strategy, that everyone has their role in the fight towards liberation, and yours can be science. Yours, like, it doesn't have to necessarily always be a march or a person who's on the ground that way. There are other ways to do it. And responsible for getting the resources that are needed to do the things. Because if, like, one of my co-partner, her name is Joanna, brilliant woman, hard worker, like, she did her CVI on her own. She started it on her own. It's called Guns Down Friday, by herself in a van. Okay.
mm,
But she doesn't have the know-how to write a grant. She doesn't have the know-how to go get this money, to get the place, to get the money, to get the resources, to get people to listen to her, right? And so those collaborations, that is higher ed's job, is we
mm,
do know the language, we do know the lingo, we do know the people, right? To get those resources, and we have access to the people to tell them that, like, people shouldn't have to come through us to get to this money. Y'all need to think differently about the criteria for these grants, who needs to be able
mhm,
to, who's eligible to write the grant, stop gatekeeping the money,
mhm,
right? And so that's the intermediary that academia in higher ed can play, and being able to touch both places, and do multiple things at once as it relates to bringing the community to the higher ed and bringing higher ed to the community, where needed.
I really appreciate this list you're laying out of things that higher ed is responsible for. So it sounds like you're saying it's not just the connections to people, excuse me, who are on the ground doing the work. It's also the advocacy and the action steps to change the way resources and funding can flow to people who are doing the work. It also sounds like being a supportive partner for people who are uplifting solutions that they're employing within community-based places. And I'm particularly struck by the one of the first things you said about how people get trained to do research. I really very much agree with that. I do think I agree. There's a comment in the chat about how academics need to approach community engaged research with a big dose of humility. And I think that part very much, that comment very much is in tune with your suggestion around like, how do we adjust how we uh, inculcate students with how to conduct research, as community engaged research, for it to be more humility based and not necessarily thinking of people in terms of numbers, and actually being able to visualize all the different elements of a community: families, community-based organizations, faith-based organizations, parks, schools, etc. So thank you so much for kicking off that list. Terry, what do you think are some of the responsibilities of higher ed? What would you add to that list?
Dr. Berry, I think great minds think alike. I really love her comments around that. Just really having a responsibility of going in as and asking themselves, am I being extractive? At this point, like Dr. Berry, I mentioned, being a conduit, where and supporting where that community or that community-based organization is lacking. Now, one thing I've noticed, like I chair a board in Inglewood called Imagine Inglewood F, and Imagine Inglewood F, we led a project around fentanyl and fentanyl awareness. How it's affecting our youth, not just older folks. You think of fentanyl and heroin overdoses as a older in age problem, but our youth there, have a lot of youth, a lot of usage in that drug as well. And, I have brought in some analysts from academic institution to support not only how you collect the data, right, but how can they leverage the data to get more funding to support the work that they're doing. An academic institution has that infrastructure already in place, with IRBs and, and people that's in those supportive roles and community outreach and, whatever team that they have to support that organization. Same with, we're running another project where we're studying maternal health and mental health and prioritizing the needs of our community. And we brought in another institution to support, Black maternal health. How can we, again, not only analyze that data, but how can we pull data from different resources, other institutions, to support getting grant funding? It comes down to the funding, because funding brings the resources. They have the infrastructure, they have the people. It's no issue with getting the people. The people want to do the work, but they just need the funding to support them to actually do the work. So academia has the ability to bring the data, right? The external data or internal data, or help support community, gathering their own data, and you as a PI on that project, so they still own the data, leveraging that data to get grant funding, so they can support projects and partnerships and programming, and then there you go. So there's a responsibility for these higher education institutions to not just research this project or this community or this geographical area, because you're going to get that anyway.
Mhm.
That's automatic. You're going to get that just by being involved. But actually, putting those action items behind that project, that's going to, that's going to last, so I'm gonna leave you with this, sustainability.
Mm.
That's all they're asking for, is how can you sustain, that project once you leave? And they can support their own projects, and how can they continue to use the same language, the same data, and get access to the, because it's a partnership built, getting access to that same partnerships, that they built during your project, and then continuing it 10 years down the line.
I really appreciate you adding that and emphasizing the funding, because that is a part of the sustainability. And it shouldn't be like, oh, well, we're not studying this anymore, so we're going to drop that. What I'm hearing you say, what I'm hearing both of you say, is one of the biggest one of the top responsibilities of higher ed is to leverage the infrastructure that is already there, not only to funnel funds for this type of research and sustain it over lengths of time, but also develop some sort of process in which there's an equity in which communities they themselves can own the data collection, be a part of solution making and implementation and further study. That's how I'm interpreting everything that you both have shared in terms of higher ed's responsibility. And I would say that is one of the mechanisms in which there can be a huge dose of humility from the beginning, understanding that there shouldn't just be a parachuting in to take a quick look at something, but rather a settling in, sort of looking to become a part of a community to help, not only for your own gain to conduct your own research, but also to become a part of creating these solutions that really do help to reduce this wicked problem. Thank you so much.
Since a lot of institutions sit in the middle of people's communities, like the school
Mhm.
be like smack, like dead
In the middle.
in the middle of it, but
Mhm.
have find a way to isolate themselves and insulate
Mhm.
themselves from the community. Like, it didn't make no sense that we had to fight University of Chicago for all them years for to have an emergency department.
And,
Like,
and it still needs a little work. Yep. Absolutely understand what you're
like, it
saying.
didn't make no sense.
Yeah, because there are a lot of other things attached to addressing sort of the physical based trauma that people experience that is more at the community level, very much like what you talked about in the beginning. And there's a whole lot more that we could do in terms of prevention. Whole lot more. But I'm not gonna go down that rabbit hole. My next question for you all, and I think this is also related to the shift or the change in federal administration at this time. How are you combating misinformation and disinformation about this problem? Let's start with you, Terry.
Yeah, I can start off. Is really giving our youth a voice. I had mentioned this before, giving our communities their own voice, and that's really putting it out. Again, I'm gonna continue to emphasize throughout this conversation, co-ownership of their own research, community-based research, because now you are addressing, all everybody in that zip code, all those families in those zip codes are criminals. Just, generalizing a specific area, and demonizing specific areas, but actually highlighting the assets and the value that it brings to that city, that state, the state, whatever, and academia can actually support that by, again, publishing, getting that information out. We talked about funding, but even if you publish all the assets, publish all the, the great endeavors and the contributions that has been put forth by these community stakeholders, these community organizations, and how many families are they impacting? What do they do to reduce, gun violence, in these specific areas? So the work that, people have been putting in for decades, for years, to support families, is really beneficial to combat that. Oh, they just want to live in, this community. They don't want nothing better. That, whatever information that's demonized in that area, by really depicting the opposite, in a formal space, whether it's a, again, academic article, a white page article, media, social media, whatever platform that everyone on the line has access to, right? I'm gonna emphasize that I'm calling out everybody on the line. Everybody has access to, whatever you can do to put, to combat that misinformation. It's really up to us all that's on the line to really put out that false narrative, that fake news about our communities.
So it sounds like you're saying tell the whole story,
The
not
whole,
just this slice of the story.
yes, absolutely.
Okay. What would you add to that, Dr. Barry?
I mean, that for sure. But also telling the whole story in the successes, because when there are successes, so I've been to a few town halls in Baltimore, and they're talking about like this is the lowest year of like shootings, lethal shootings in Baltimore. And of course, the police are all taking, credit for this reduction. And it's like, I think y'all are forgetting some people and who actually, right, deserves the credit for this reduction that we're seeing. Like, who is actually responsible for it? I think again, the humility comes back in again. Like, you lose nothing by saying that it was XYZ agencies who have these such workers, and we can attribute like there's not but they're not doing that, right? And so telling the whole story on the success stories and giving the people who did the work what they're due monetarily, because thank you for your thanks, but I would like to eat, so pay people. And we need to change the way we do dissemination. There's not only one way to do dissemination, right? Have something that y'all are serving people food. I bet they come. Put the money in and have a community where you are serving actual food, you're giving out bus cards, you're doing something that meets a need. People will come, and then you can give them, then the people who did the work can talk to the people who are in the community, right? You can help them, the people you're partnering with, translate the science language into language that the community can understand. Have them present the work. Sit down. You know how to do it. You about to go to 5 conferences this year and talk to the people and have your little love talks with other academicians, and you can do that all day. So that means you need to do other forms of dissemination so that the people who it's actually for have access to it. Have these meetings at schools so the parents can know what's going on, that there are these things, that there are these programs, that these things are happening, to encourage them, because people really be needing encouragement, because it looks bleak. If you're just, even people who live there, it looks bleak. We might be out here being like, yes, it was only, there was only 300 shootings this year instead of 400. That's 300 people's children though, still. Like, even though it's less for us, that's still 300 people's children that died this year. And so while, yes, it's less, it still feels very bleak if you're the person who is living in the place that got shot up, right? And so I think diversifying the way we disseminate information is a big one. 2, being humble, telling the whole story. And 3, engaging the people who did the work to be the ones who are disseminating the information and not it always coming from us, because people don't trust us. And even though I look like them,
Right.
I'm representing a system that they are particularly fond of. So even though I look like them does not mean, they'll be like, oh, go Black person, you go tell the people whatever. But it's like, I'm still showing up here on behalf of the University of Maryland. So me being Black, that only gives me a little bit of something. After that, it's like, okay, girl, how are you different than other people, other than the fact that you're Black?
A fair question. Yeah.
It's
Given
a
the
very fair
history.
question.
Yeah.
Right. So I just think that the disinformation and misinformation is by lack of creativity of how to disseminate information. We're just stuck writing articles, going to conferences, talking to each other, and using language that's only for each other. And that's it. And if it does make it to the news, then the journalists are using their own language to talk to each other, right? It's no one's, the people who are actually doing it aren't the ones talking, even though they should be, since they're the ones that are impacted by it and they help do it. So they should be the ones speaking.
I really appreciate this additional list that I'm hearing. So diversifying dissemination, making sure you're not talking to your own echo chamber. You know, we see this happen a lot with people on social media. They're kind of having the same conversation with the same people, and that there really isn't any branching out to learn. And I think ultimately that diversifying dissemination is a critical part of everyone's learning. Maybe there's some things that you haven't thought about that's happening over in this community over here. It's important to hear from people's own lived experiences. Have they seen the change and what is it? And how would they describe it? How has their quality of life been impacted by a reduction in shootings? If it hasn't, that raises more questions for me. And I really appreciate this other critical point that you both are making in terms of telling the whole story. And I assume that also includes some root cause analysis, because a lot of times when we look at the channel, you know, the 10 o'clock news on whatever channel, you get the blurb about the shooting, but there is no analysis about the cause. And so there is a constant pushing of a particular unclear narrative about violence in urban areas specific to Black and Brown people, but there's no analysis around, well, what's causing this? And certainly not any historical analysis. And so I appreciate how all of these lists are important, and all of these lists can be enacted by higher ed. So I'm really enjoying this conversation today. Before we jump into small group discussions, I thought it would be great, and it's something we're asking all panelists. What partnerships and projects are you currently involved in to address this wicked issue? And you might have said this before, but we want to be able to provide some links in the chat. So if you could mention some of the things that you're doing with specific projects, it could be research, it could be intervention, it could be a number of things. Who are you working with and where? And we can start with
You're local, so yes.
we can start with you, Terry.
Yeah, I'll jump in. Shameless plug. Again, I chair a board in the greater Inglewood community called Imagine Inglewood F. And we just acquired our Peace Campus, which is located on 64th and Honorary. So the entire collaborative is, it's a block-based community center that consists of like 16 properties. That includes 5 houses, 2 basketball courts, community garden, a nature play lot. We actually named those houses the Peace House, Imagination House, and Inspiration House, and Power House, Healing House. So Healing House is about to open up actually at the end of this month. And I really want to focus in on that house because it emphasizes mental health, and we're addressing, we partner with some different community health partners that help support us in that space. So people, again, meeting people where they are, where they live, work and play, and addressing those issues. So mental health is a huge, especially this generation. If you haven't noticed, if you're any parents on the line, you notice this generation, they wear their mental health on their shoulders. Versus us, we was kind of tight with our mental health. They will express it. So we want to address that because we hear them, and so we address that with our Healing House. And then again, our Peace Garden, Peace Court, our nature play lot, and then our Healing Court. So if you haven't had a chance, please visit our website, imagineinglewood.org, and come and visit the Peace Campus. We have a lot of festivities and addressing, again, those root cause analysis, root causes, those social determinants in our spaces.
Okay, we'll be sure to provide that link. Rabiatu, any partnerships, projects you want to highlight?
Yeah, so partnering with, so my gun violence, the hospital-based intervention, I have a community advisory board. It's made up of different people who do different work, and they pretty much all have organizations. And so Guns Down Friday is one of them. Her name is Joanna Hardy, started that organization, which is a CVI, and she's always in need of funds. So if someone feels like they need someplace to donate their money, please feel free to donate it to Guns Down Friday. She services the greater Washington, D.C. area, literally everywhere. She works part-time for Children's National Hospital doing their CVI work on the unit, but most of her work is in the community, between her and her uncle and her van and her truck, literally, is the work that she's doing. The Trigger Project, which is a youth-based organization, who basically the mission is to re-envision a DC with no gun violence. Like they're in their mission statements, like to end gun violence, I think they said by 2030, altogether. And so they're a great organization. They have a gun violence kind of like festival on the National Gun Violence Day in June, but they're having to end it because funding. So and the work that's involved in putting it on. So one of them is actually coming to work with me as a community recruiter, for this project. So those are two big ones that I am connected to. And at Progress's website, you can see other organizations that other researchers who are affiliates of Progress also work with. So I tend to focus on youth organizations, and so all of mine are going to be youth focused, but they're ones who do more traditional kind of like CVI work with adult men and women. So yeah.
Thank you both so much. So right now we're going to transition into some small group discussions. And you'll see that I've populated 3 questions. Nicole is going to break everyone up into small groups. You'll have about 20 minutes. These are the questions I'd like for you to try to get through. When you all come back, I am going to ask for a volunteer to share some insights that that came up from your small group discussion. And in the meantime, myself and the panelists will be working on putting those links in the chat to the projects and partnerships that were named and highlighted today so that you can check them out for yourself once the webinar is over. And with that, I'm going to ask Nicole to put everyone into small groups, and looking forward to hearing what comes out of them. All righty. It looks like everyone is back from the small breakout sessions. So I'd like to just have one volunteer share a little bit about what you discussed, any insights, epiphanies, action steps you're willing to take. Feel free to raise your hand. And I am a teacher, so I will call on someone. All right, Janine, hello, thank you.
Hey, yeah, I'm happy to share what we talked about. So I'll say, first of all, issues of funding are consistently a problem. And as we all know, and as the speaker said as much, and one of the ways that this has been showing up in work that Melissa is doing in Fairfield in Connecticut, I believe, in the nearby city, is that they're doing a community engaged research project. When they first approached the community, they suggested having a core group of community leaders that would be leading that work and performing that work. They have funding to pay people and things like that. And folks really insisted on having all community leaders involved. And so with some sort of hesitancy, they agreed to that. But then when it came time to actually go out and perform the surveys and begin the work, about 75% of the people dropped off and couldn't do it anymore. So it ended up being kind of the same core group that they had originally intended. And just like some concern about how that gets communicated to funders in a way that's going to, consider the grant and the work to be successful. And with people that they already had relationships with and things like that. So, it's just stuff that happens. One of the big things too that came up was that this is about so many things. And one of the ways that we're approaching this where I'm at in Minneapolis, in Cedar Riverside, which is a really densely populated neighborhood, not a lot of space, and a neighborhood that experienced a lot of gun violence in the past, and then it really waned considerably for a long time, and now is coming back up. And really, as the opioid crisis ramps up again, in particular. And there's a community center that we work with closely that's run by a nonprofit that last year started a program called Groundwork, which Melissa says there's something similar where she is too. And I don't think they're connected, but it'd be interesting to know. But the program provides paid jobs for young people, middle school and high school, and also people who are using or in recovery to have really temporary casual labor to help sort of integrate them back into the workforce. So young people are there 4 or 5 days a week, 4 hours a day, doing landscaping and gardening work in a series of small gardens. We live in a neighborhood that is almost totally neglected by the city without a lot of green space. So being to activate any of those spots where one, people are often using spots that have been encampments previously for unhoused folks, is having like an enormous difference. Young people are getting job training skills. There's been crew leaders of young people who are in recovery who have now gone on to get landscaping jobs where they're doing well and making money. It's activating those spaces in ways that people are using less in them. And all of this really just, I think, expresses to the neighborhood and the communities of people who live there and who come to visit the kind of love that exists in the neighborhood. And yeah, it's just a great project. So we're co-writing a grant with them right now to provide student workers to help out with youth supervision and performing some of the labor, hiring a staff position to act as a liaison between our community garden on campus and the gardens in the neighborhood. And our interfaith department is also working to provide some restorative justice training for youth and other folks who are in the groundwork program to help them learn how to better communicate and be in relationship with people who are using both in their own families and in their own communities and that they encounter as a part of their work in the neighborhood.
Thank you so much for sharing all of that, Janine. It sounds to me like you've highlighted some similar challenges that were raised by the panelists today, especially around funding and also how to communicate what success looks like to funders. So I think that speaks to the panelists' suggestions around how do we advocate for how funders fund and consider success. And I also appreciate you sharing some of the work that's happening with students that you're working with. Did you say Connecticut?
We're in Minneapolis, but one of the other folks was in Connecticut.
One of the other folks in Connecticut. Thank you so much. As we wrap up today, I have one more question for our panelists. Something that I think we all want to consider chewing on even after this webinar. What are some action steps that researchers can take now to address this wicked problem? Terry, would you like to start?
Sure. Publicize, this wicked issue, series. Just emphasize and advocate and support. I think everyone on the line, if you're here, that means you're already doing the work or involved in the work. So I say, just continue to do that work. But action steps specifically, find your local community-based organization that actually has the infrastructure and look for different ways to support them. You can start there.
Thank you. Dr. Barry?
I was going to say the same thing. So to that point, building a coalition on your campus of other faculty members to do this work, because you also can't do it by yourself without being in community. So, and because like I said, point of being a wicked problem is that there are many ways to address the problem. And so, go find your colleagues that are in atmospheric studies, go find your colleagues who are in the English department, your colleagues who are in other fields in engineering, right? Things that you wouldn't necessarily think might be able to address it by community-based gun violence. You'd be shocked what people can do in other fields and the way they conceptualize things. And so build a coalition across your campus, interdisciplinary, so the community can actually benefit from all different kinds of thought leaders and solutions to different kinds of problems, as opposed to all the behavioral science people getting together, because all we're going to think about is behavioral science, right? and leave out some of the more structural things that maybe an engineer might come up with around, designing buildings or, stop signs or whatever, right? Things that we wouldn't think of because that's not our field. And so I think building that coalition, and then the coalition going out and doing a needs assessment with community organizations that are already doing the work. What are y'all doing? What do y'all need? And how can we help?
All righty. Well, that sounds, well, it's simply stated, but it's a lot of work, but it's a lot of good work. So get connected and coalesce and move things together. It's internal to your campus and definitely in the communities that they sit in or their neighbors with. I want to take this time to thank our panelists, Dr. Rabiatu Berry and Sergeant Terry L. Williams today. And at this time, I'm just going to pass it over to Nicole.
Well, great thanks. Many thanks to everyone who was here. Again, thank you to Dr. Williamson and our panelists for exploring how community engaged research can play a vital role in addressing this wicked issue. I know that I learned a lot and took a lot of notes because that's what I do, even though my camera was off. Our next session is scheduled for Wednesday, February 19th, again at 3 p.m. Eastern Time, and we will focus on community engaged teaching and learning. As the panelists and Camille have all said, so we invite you to share this with your colleagues. I put a link to the registration in the chat. And we also are looking for other people to share their knowledge with us, whether you have research that you've done or resources that you have, or you're interested in being a panelist. You can follow this link that is also on the website, and you can share your expertise with us. Until next time. Thank you so much for being with us, and we'll see you in February.
See everyone.
Thank you.
Thank you.